Residents in HIGHFIELD in Harare turned out in numbers to receive free medical services at St. Paul's Anglican Church in the suburb. The outreach was organized by the church in conjunction with Angels Foundation and its partners as part of the foundation's Doctors and Nurses on a Mission initiative.
Outreach committee yedu iboka rinoshanda riri pasi pechechi rinotarisa zvakanyanyisa kune vanhu vasingawani zvichida maschool fees, zvichida chikafu, zvichida medication. Saka outreach inotarisa maareas ese iyayo ichibatsira kuburikidza nemari yatinowana kuchechi. Nhasi tiri pano takabatana neAngels Foundation tichiita clinic yedu iyo yabatsira vakawanda vanga vasingakwanisi kuenda kunoona ana chiremba. Saka tiri pano nemachiremba ari kukwanisa kubatsira vanhu kuvatarisa achivapa mushonga pachena.
The services included medical consultations.
I've seen a need in the society because I work at Harare Hospital, which is a central government hospital, and I've seen many people who struggle to even afford basic procedures or even just the consultation fee and to then buy the medications. So I really joined because I want to help as many people as I can with the skills that I have. I might not have the finances to do it, but at least I've got the skills to do a consultation and be able to help that person, that person's health.
Today we were in HIGHFIELD and we were giving out free medications, free medical advice, medication reconciliations, understanding that the patients have the right medications and they're working out for them.
Reproductive health.
As population service outreach team, we offer family planning services for free. Why? Because some women, they don't have access to the family planning services. They don't have money, but they need the service. So we are here to give them the family planning services for free, even if they don't have any access to others, to the services where they can pay. Here we are here to support them.
And nutrition education.
On this desk, we are offering nutritional counseling and offering dietary advices to patients. As you can see, there are lots of patients who are here who are serving the community. I am a nutritionist. Together with other professionals, we work hand in hand with doctors, with pharmacists, with other professions in the medical field, so that we help the community at large.
So nutritionists basa randanga ndichiita zora nhasi chekutanga kuvadzidzisa pamusoro pemapato mana ezvikafu zvavanenge vachifana kunge vachidya. Zvikafu izvi zvitanga tichitanga tavabvunza kuti zvoni zvii zvavanazvo mudzimba dzavo, uyezve nekuvakurudzira kuti havafani kunge vachibuda muhomwe yavo, asi kuti ngavatarise zvavanazvo mudzimba dzavo voisa muplate mavo kuti vakwanise kunge vachidya chikafu chine utano chinodzivirira kuti BP irambe ichikwira asi kuti BP iderere. Tanga tichikurudzira ana gogo vauya vakasiyana siyana, vamwe ndo vanga vane matambudziko edisability, nekuti takaongorora takaona kuti disability nenutrition zvinhu zvinofambidzana zvakanaka. Vamwe vanogona kunge vakabarwa vakaremara, kukura kwavo, utano hwavo, takatarisa nyaya dzenutrition kunogona kunge kune dambudziko. Saka muzuva ranhasi wanga uri mukana wanga wakanaka chaiwo wekuti tibatsirane necommunity, nekuti tingaita zvese, vanhu vangapiwa mapirisi, vanhu vangapiwa mishonga, asi kana pasina chikafu chakanaka chinodzivirira zvirwere kana kuti chinobatsiridza kuti zvirwere zviite se zviparare muvanhu, hapana kwatinenge tichienda.
Physiotherapy.
Most of our population, it was the old people, so I made sure that all the people who could not walk, I made sure that they were walking and going to all the stations that they wanted to go, whether for the BP checkups, to the dentist, or to the optician.
that was my role, just to make sure that everyone was mobilizing.
Optometry.
Most of the patients you find are a bit, are elderly patients. So because of that, you find that eye problems are fairly common. Things like difficulty reading, things like like cataracts, other things like that. So you find that there is need for maybe some sort of eye surface or some sort of assessment of their eyes. So that's something that I think is helpful for them. These are more screening tests that I'm doing. Maybe just testing vision, just having a look at people's eyes. There are certain people who have got conditions that need further evaluation, obviously. But even the screening is something useful, so we are able to pick up certain problems that we can deal with there. Other things maybe we need further testing and evaluation to get to the bottom of.
And dental services, among others.
Turnout has been exceptional, and I see the community is being well served, resources permitting. Our team has come in large numbers to support this event, and it's going on very well.
My job here today is social welfare and monitoring and evaluation. We are looking at the societies that our beneficiaries are coming from, how we can improve their access to healthcare, and if there is anything that we can do at all to help improve their livelihoods pertaining to their healthcare. So we do have questionnaires here asking them how far they had to walk, how often they get healthcare, what we can do in general to help them have access to healthcare. So at the end of the day, we are going to be more evaluating on our program. How successful was it? How many people did we manage to help? Must we do another program like it? Must we cut it off? Must we start a new program? That is what us as development practitioners will be doing here today.
A key provider of medical diagnostic services in Zimbabwe, Lancet Clinical Laboratories, was one of the partners at the outreach.
As Lancet Laboratories, we do various tests, breast cancer tests, we do cholesterol, we do HIV tests, cervical, diabetes, just to mention a few.
At the outreach, Lancet engaged citizens, distributing information and education material. Lancet also provided personal protective equipment used by the medical practitioners at the outreach.
We are a lab that firmly believes in giving back to the community. So when Angel Foundation reached out to us and said that they are having this wonderful program, how best can we chip into this program? We spoke to our bosses, Dr. Charles Moronda, who is our CEO and managing pathologist, and he was interested in the idea, and he said we can provide these guys with personal protective equipment which they are wearing today.
Population Services of Zimbabwe was one of the partners at the outreach.
Today we'll be offering family planning services for free. Short term, that is Pius Depot, then long term, Jadel, Loop, and Level Plant.
Chanyanyondifadza ndechekuti tapinda munana chiremba vachitibata zvakanaka vachitivhunza kwese kwatinoenda kana tichienda kumahospitals kana kumadoctors tinofanira kubhadhara mari asi nhasi hatisi kubhadhara tiri kungoningirwa pachena saka zvinofadza kutariswa nemadoctors pachena nokuti vamwe vedu vari kutotadza kuuya kuzorapwa nenyaya yekuti vanenge vasina mari yachona yekuendesa kwachiremba kana kumaclinics.
Tinode kutenga maningi neava vana chiremba vakadaidzwa neoutreaching vari pano kutishandira nhasi unoyu. Zvinode kutendwa Jehovha.
Dai Mwari akavakomborera pabasa ravo ravari kuita. Vari kuteedzera zviri mubhaibhiriwo zvokuti Jesu aifamba achirapa vanhu kusina mari kusina chinhu. Saka toti madhoktors aya ndo zvavari kuita nokuti hapana chavari kupiwa, vari kupedza basa ravo instead kuti ave kusejari kwake uri kuti kubasa kwake aona time yekuti auye kuno kuzoti atibatsirewo chembere dzake nevamwe vadiki varipo. Tinozvitenda izvozvo dai Mwari akaramba achivawedzera upenyu hwacho norudo rwacho.